today we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care home. We'll test all symptomatic care home residents, and as I announced last Friday, we've introduced testing for all social care colleagues and members of their households who need a test. At the same time, we're increasing again PPE supplies to social care. We're creating a supply, logistics and distribution network of unprecedented scale. One of the things that I'm most proud of during this terrible crisis is that people have held health and social care workers in such high esteem across the board. It's not clap for the NHS, it's clap for our carers. And to take this further, we're today introducing a single brand for social care to symbolise the entire care profession. This is something I know so many people in the profession have called for. This badge will be a badge of honour in a very real sense, allowing social care staff proudly and publicly to identify themselves, just like NHS staff do with that famous blue and white logo. I know that many businesses will want to offer the same recognition and benefits as they do wonderfully to the NHS. We've asked the supermarkets to confirm that social care workers can have the same priority access, and I know that the public value your work in care as much as I do. I also know that we need more people to return to social care or choose to serve for the first time. To make that happen, we're strengthening our national recruitment campaign with the aim of recruiting tens of thousands more people into social care. There's one other thing and one other change I want to make, which is giving people the right to say goodbye. One of the important things that care homes do is support people at the end of their life. Sadly, even in normal times, each month, about 10,000 people die in care homes. And our social care colleagues work incredibly hard to ensure support for people and dignity to people at the end of their lives. Wanting to be with someone you love at the end of their life is one of the deepest human instincts, and it's a moment that will be with you forever. Done right, it can help those left behind to cope, and it brings comfort to those who are dying. Coronavirus, of course, has made this much more difficult, and I've been really moved and upset by some of the heartbreaking stories of people dying without a loved one nearby. So I'm pleased to say that working with Public Health England, the care sector and many others, we're introducing new procedures so we can limit the risk of infection while wherever possible giving people's closest loved ones the chance to say goodbye. And we're making crystal clear that it is unacceptable for advanced care plans, including do not attempt to resuscitate orders, to be applied in a blanket fashion to any group of people. This must always be a personalised process, as it always has been.